for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show for Tuesday, June 23rd, 2020. We're going to be talking with Dr. Ralph M. Zagha, board certified in urology, www.drralphzaghamd.com. Dr. Zagha, how are you doing this evening, and thanks for joining us.
Great, David. Good to see you again on Men's Health Month in June. Really appreciate it.
Yeah, we appreciate you taking us on. I always say this adventure of health because we learn so much from the doctors. You sound great. You look great. Let's get started because it is June, is Men's Health Month, and we had you on. It's funny. I look back. We had you on. I think it was June 19th last year. So June rings around, and I'm looking for you because I want to talk about men's health, but we will talk about women's health as well. So we think of June, Men's Health Month. Men think of, I got to, maybe make that doctor appointment, maybe make it there, make my wellness visit. What are some of the things that men should have on their radar in terms of urology health? Not only, I guess, this time, but I guess, all year round.
Sure. Thank you, David. So most men want to start thinking about their men's health in their 40s and definitely by their 50s. And most men's health is mainly around their prostate health, and it's centered around that. When we start thinking about prostate health and checking your prostate by age 50, sometimes a little bit earlier based on your own personal family history. Usually prostate health is checked with an examination in the office, and often with blood tests with PSA, which is a prostate-specific antigen. Other men's health issues can arise from erection problems, which can be treated in a number of different ways.
Well, that's great to know. Yeah. June is a good time to think about it, and also as well as the prostate. So I was just thinking about that age in the 40s because I'm right there, and I was just taking in exactly what you were saying. And we, most of us by now have had a friend or maybe even family member, someone in the family who've gone through the the prostate surveillance or radiation or surgery. So you hear a little bit about it, but it's again a good time to think about it. Let's stay on the prostate topic for a bit there and start there because that seems to be very high prevalence. Obviously for men. Now, was I correct in saying there's like three kind of options, or maybe correct me if I'm wrong, of surveillance or radiation or even surgery if, prostate cancer develops to a point where it, risks, someone's obviously health?
Sure. So just talking about the prostate itself, you could have prostate enlargement, in which most of the time the men will experience symptoms of urination troubles, either a weak stream, urinating too often at night, having trouble controlling the urine, and that's a prostate enlargement issue Whereas prostate cancer, initially, there really aren't many symptoms. So you really have to see your physician, either your primary care doctor or your urologist, again, with the examination and the PSA to diagnose prostate cancer. If it is localized, there are those a few traditional ways of treating prostate cancer, either with surgery, where we're utilizing the robot more often, or radiation therapy, which is done without surgery. What you alluded to is called watchful waiting, which quite often, depending on the circumstances, we're not subjecting the patient to any immediate treatment. We're watching the PSA, we're performing repeat biopsies or even MRIs to determine the nature of the prostate cancer. And quite often, patients do not need treatment. There are other modalities, ultrasound focused, proton beams. There are other traditional modalities to treat the cancer. A lot of different ways to treat it.
Yeah, I always say when doctors give us a lot of options on this show, I always, tell the listeners and viewers, it's like having a lot of tools in their toolbox, when they have that many options of looking at something. And thank you again for clarifying it, because I had a little wrong. There's prostate enlargement and prostate cancers. It's two different spectrums there. So I just learned something, and that's one of the reasons we do this show, because we're able to have doctors on and generalize things. It helps us all learn a little bit more. Let me give out your info, because we're going to get into a whole bunch of other topics, but I want to give it out a few times. Again, it's Dr. Ralph Zagha, board certified in urology. The website is drralphzaghamd.com. That's Dr. Ralph Zagha, Zagha, MD.com. Zaghamd.com. So I found a ton of info on that website, and I always tell doctors when I have them on this show, if I, really found their website, educational, I'm going to mention it on air, because there's a ton of info on there. I mean, not only everything from insurances, but all the hospital procedures you do, in-office procedures, your education and training, because, people look into that a lot nowadays. You got board certified in urology right there, so it's a great resource. Again, it's drralphzaghamd.com, and the number's 954-652-0246. We've talked a little bit about some of the main things you treat for men, and we are going to talk about some of the things for women as well. What are some of the other urological diseases and conditions you treat? I know there's a lot of them, probably can't get to all of them, but what are some of the most common besides enlarged prostate or prostate cancer?
Sure. So in the office, we do see a lot of conditions focusing around erectile dysfunction. We see a lot of kidney stones, a lot of voiding dysfunction or urinary incontinence, and blood in the urine, and that requires a workup to figure where that blood's coming from.
And then for women, obviously it changes a bit, but some of the same, ailments as well. Obviously some are different, but some of the same. If you could share a few of those that you are more common.
Sure. So other than the prostate, women can get the same cancers that men get regarding bladder cancer, kidney cancer, blood in the urine, which requires a workup for the woman as well. They can also get kidney stones. Women tend to get urinary leakage issues or control issues for different reasons than the men, which require different treatments. But for the most part, they can be quickly and easily diagnosed and addressed.
That's great to know. And again, it's drralphzaghamd.com is the website. Ton of info there. You can get the address as well. The phone number 954-652-0246. We know as men, we got to start thinking about this in our 40s and 50s urology health. Excuse me. And so, but what age range of patients do you see in your office?
So in the office, we generally see adults age 18 and over. In the hospitals, it ranges all over the board. Occasionally, I'll see pediatric emergencies. But for any outpatient pediatric issue, I recommend a specialist in pediatric urology.
Okay, great to know as well. So for urology care, you offer obviously the community both the options in office. You've said in office a few different times, and I think that's great because what I found on your website and from interviewing last year is that there's a ton of things that can be done in the office and the convenience of the office, which is great. What are some of the ways you're able to keep patients comfortable in that setting? You and your staff obviously um, take that into account, and in office safety, because nowadays we have obviously this pandemic and it looks like it's not going anywhere soon. So tell us a little bit about the office and what can be done there and the safetiness of the office.
Sure, thank you. So we have a great office staff. Most of the staff have been with me for years, some decades. They make you feel very comfortable. We know some of the issues we deal with can be very sensitive, especially with COVID now. We're being very careful not to overbook and try to get patients right back to the examination room. We do quite a few different procedures in the office that you mentioned, as far as looking into the bladders, doing bladder tests called urodynamics, ultrasounds, and even office-based vasectomies and circumcisions. And again, keeping the patient comfortable and safe.
That's great news for our South Florida and beyond as well. Again, it's Dr. Ralph M. Zagha, MD, board certified in urology, Dr. Ralph Zagha, MD.com, 954-652-0246. Dr. Zagha, hold that thought. We're going to take a quick commercial break and talk a little bit about what you do in the hospital setting on the You and Your Doctor show.
Great.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor Living a Longer and Healthier Life show. Thank you for all of you watching on Facebook as well. I see we're in the double digits there, so this is an important show. Great to see. And if you ever have a question, 888-565-1470, and we can try to get you on with the doctor as well. Dr. Zagha, we were talking a little bit about what you do, actually a lot about what you do in office, which is fantastic. And then I did want to get to the hospital questions as well. But before we get there, take us I never get to do this with a doctor, but we have a little bit of time here. Take us kind of into a virtual tour of your office. We're walking in the door. What do we see? What do we expect?
So we have a beautiful renovated office, modern feel to it. You walk in, you're greeted by one of two medical assistants in the front desk. And again, with COVID, we're not asking you to write down anything. If you can do your paperwork ahead of time, it's downloaded from my website. They ask you for some ID, get you back to the room. You'll meet a different medical assistant back there, take some information about your medical history, your medications, any allergies, and then you'll meet me. And again, a very comfortable feel, a very, very quick throughput, and really try to limit your wait time.
That's great. And again, that website is drralphzaghamd.com. That's Dr. Ralph Zagha, Zagha, MD.com. Just Google Dr. Ralph Zagha, Zagha. It'll come up and you'll find it and you'll be there. There's a ton of info. You'll know when you're there. Let's talk a little bit about what constitutes the need for someone with a urology ailment to be admitted to the hospital for testing or an operative procedure. When is it something that can't be done in the office, or maybe it should be done more in a hospital setting? Take us a little through that.
Sure. So some of the surgeries that I recommend to my patients regarding prostate or kidney stone, bladder tumor surgery, we're going to do in the hospital setting. Most of these can be done as an outpatient basis, some in the surgery center. And then there's some other urologic emergencies where you'll meet me in the emergency room or up on the medical floor, usually regarding blood in the urine, which is getting significant, kidney stones where you cannot control the pain and you might need more emergent surgery, or urinary blockage, whether it's the kidney or the bladder. You might need some intervention from a urologist in that point. And just to elaborate more on the COVID, it is safe to go to the hospital for any medical emergency. Of course, we don't want you there if you don't have to be there, but we are doing elective surgery very safely. Most hospitals are checking COVID status ahead of time.
Yeah, and I get the updates all the time from Jeffrey Welch, your CEO, with the COVID-19 email blast he puts out. Great information there. I've learned a lot myself from that blast, so I just wanted to give him a shout out as well, because that's great. They're on top of it at Florida Medical Center campus in North Shore over there in Fort Lauderdale. And great thing you said there. Most of the urology procedures at the hospital that you do are outpatient. I mean, in certain cases, obviously, people may have to stay a little bit longer, but that's great news, because one of the things they keep on saying in this show, doctors and healthcare workers, they were practicing, safety protocols, always wearing gloves, and masks as well in the hospital setting long before we had this pandemic. So definitely a safe place to go. And you can elaborate on this, because you have numerous hospital appointments since you've been here in South Florida. If you could just share with them, with our listeners, a couple of them. So you've already, been top leadership at this hospital, Florida Medical Center.
Sure, David. So I'm currently chief of staff at FMC campus, which is a campus of North Shore. I've been chief of staff for the past 3 years, so I have a lot of leadership roles at that hospital. I'm also involved in other committee roles at surrounding hospitals, at University Hospital in Tamarack, Plantation General, and I do also go to Westside Regional Hospital in Plantation. And let me just say, all these hospitals are phenomenal. The staff is fantastic. And again, especially with COVID, they're being very careful with patient contact.
Yeah, and I can, the COVID patients, we've all heard it in the news. We've all seen it from the hospitals themselves. There's a different, area of the hospital where, the COVID patients are treated and monitored, rather than the area that anyone would be going in for an outpatient procedure to see Dr. Zagha. So that's important to know, because it's all about quality of life. And there's a reason the elective surgery procedures was lifted, because these things, need to go on so we can all, have a healthier life. And hopefully, obviously things are happening to flatten the curve as well. Can you also share us, we have a few more minutes. I'm glad we got to this, because I don't think we got to it last time. Your education and training, because I know you've been down here in South Florida for, you can share with us almost a few decades, but share with your education and training, and then your professional experience here in South Florida.
Sure. So I'm originally from Northern California, around San Francisco. I attended UC San Diego in La Jolla, California for 4 years for college. From there, I went to Tufts Medical School in Boston and stayed in Boston for my surgical and urology training. So I attended Massachusetts General Hospital for 2 years of preliminary surgery, and urology was at Leahy Clinic and Boston Children's. In 2006, I came down to Florida, and I've been here since. I've been here almost just about 14 years, and I enjoy practicing in a diverse community and with amazing colleagues.
Yeah, we're glad to have you here in South Florida. And yeah, I'm glad I asked that question too. I didn't know you grew up in Northern California and then you were on the left coast and you came over to the East Coast and then you came down to Florida. So that is great to know as well. We're really glad to have you here as well, and all these options in office and in the hospital setting for, urologic ailments. I always never get to this question, but I'm glad we did as well. Why did you decide to become a urologist? I always am fascinating by this question because I know when you go through medical school stuff, sometimes you don't know your path, and it's something that may happen along the way. And I may be wrong here in residency training as well, but I'd like to hear why you became a urologist.
Sure. So it definitely was not on my radar going into medical school. Going through the courses, you realize you might like surgery or might hate surgery. And once you believe you'll enjoy doing surgery, you can choose to stay in general surgery or further specialize either initially or later on. So I enjoyed my urology weeks that I spent as a medical student. I enjoyed the fact that they perform very large surgeries to very small surgeries, inpatient and outpatient, and they also perform office procedures. You can see the patients from a medical standpoint and cure them with medication like an internist might do, and then you can also fix them with surgical options. So I did enjoy that.
That's a great way of putting it, and you really got the best of both worlds. I mean, because you have an in-office and the hospital setting as well. It's not like you're like a specialized surgeon that may only be in the office 10% of the time or X, amount of the time. So you really, like you said, I mean, it really is the best of both. So I'm glad we got to that question because that is really neat. And it must have been in the Boston area. It must have been during residency a pretty busy time for you as well. You must have seen a little bit of everything.
Yeah, very busy time, very memorable time. You definitely learn a lot during training. At the time we were training, there were no work hour limitations. And in fact, that began the day I graduated. So there were some weeks we were working up to 120 hours per week, which again wouldn't happen now. But it just leads to amazing experience.
Yeah, and it leads to amazing care as well because you put in the time and effort, and it really, help to give you the experience that you need to, run a very successful urology office and in a hospital setting as well. Wow, we ripped through. I didn't get to my last question, but if you're doing 30 seconds, what are your hobbies and passions in life outside of medicine?
Well, a very busy life at home with the wife and 3 amazing children. We're playing tennis and piano.
That's great. Well, again, it's Dr. Ralph Zagha, MD.com, 954-652-0246. Dr. Zagha, thank you so much and all the info, and we really appreciate it.
Thank you, David.
All right, we'll try to see you before next year. I'll definitely have you on again. Have a good one.
Thanks.
Stay safe now.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.